Hello everyone, my name is Zinab Abdulkadir. Today I will be going over my risk management project for Dr. Bascaron's Information 645 Health Risk Management for Mercer University. So during my presentation, I'll just quickly go over my risk management plan development, identify some risks, mitigation plan, analysis, risk matrix, and additional information. The first thing I will be discussing is the risk management plan development process. So the first thing you have to do is identify the risks. I identified a few risks, but I'll only mention three. The first risk I noticed during the scenario was Dr. X utilizing his home computer to view patient information through the web portal. The second one I noticed is Dr. X manager downloaded patient assessment from the web portal and saving the document on his office computer. And I also noticed lack of interoperability and accessibility of patient information. When doing a risk analysis, I noticed that the risks mentioned above can cause significant damage to an organization through legal actions, from lack of security handling or lack of security or handling of patient information, limited interoperability, and lack of accessibility of data. So when you consider the alternatives, risk control is basically providing a prevention plan and securing patient information, investing in a documentation system that allows the sharing of data without the hassle of additional login information, and providing access to patient information for the healthcare provider regardless of location. A few exposure avoidances that I've noticed was avoiding downloading and saving patient information on personal computers, limiting the use of unauthorized use of non-secure internet connections that can cause vulnerability and increase the risk of hacking of patient information. And also allowing access to medical professionals to continue the plan of care for the patient. I found that when it comes to the best risk management techniques, I found that the best way to manage this is to basically implement certain policies and procedures, making sure that you educate staff members to not use non-secure internet connections when looking at secure information, and basically reporting if any flags have been notified of identity theft or anything within that nature. The implementation techniques is basically supplying patients with surveys and suggestion boxes, limiting the information that can be used on the web portal outside of the healthcare facility, reviewing patient satisfaction rates, increasing cybersecurity when it comes to exchanging information, and basically overall satisfaction when it comes to staff members and also patients when exchanging health information. So the last thing is improvement. With time, things should improve if the proper plans are put into effect. The risk mitigation plan. So when it comes to the risk mitigation plan, I'll look at risks and consequences, risk probabilities, impacts, and priorities. So the consequences that can occur from this is basically identity theft of patient information, hacking of web portal, and unable access to appropriately pull health information data if the provider was in an emergency situation that needs that information readily available. Probability is that there's a high probability rate due to exposure and risk of patient health information if it's being so easily accessible to non-authorized users but not accessible to the healthcare provider. And according to the scale I used, I found that the probability is very likely. There's a high likelihood of it for it to occur. The impact, I found that is if there's proper interventions and implementation to help increase the security and create easier options for the physician to access information, there'll be a positive outcome. And the priority is that I applied the probability and impact matrix that I basically found online, and I used the likelihood of patient information being hacked without when there's lack of cautious use of unauthorized internet connection, and the impact and the consequences will also be high. This can cause the patient to experience theft and also have the organization undergo legal proceedings. Legal limitations. So when it comes to legal limitations, I found that personally I haven't seen anything ethical that I can acknowledge within the scenario given, but I did find some privacy issues that occurred, and the privacy issues is that within the given scenario that Dr. X was accessing patient information from his home computer, and the physician was not properly applying safeguards when it came to handling the patient information. And there was also confidentiality issues when it came to Dr. X transmitting patient information from his facility to the nursing home facility. And within the scenario, there wasn't no mentioning of patient consent or verification that allowed the medical doctor to take this course of action. So when it came to my risk matrix, I found certain things when it came to the impact, the cost, the triggers, the strategies, the laws that affected it, and a few extra comments. I found that basically there needs to be authorized signed consents. There should be no unauthorized use of patient information outside the facility without secure web access. There should be a registration of data of patients' data, and exchanging information should be readily available and easy when it comes from one entity to another. There can be they can apply a better security system, handle patient information more carefully, create search options, and allow providers access. And I briefly already mentioned the privacy and the confidentiality and ethics that go along with this. So the risk analysis plan, this is when it focuses on risk factors, descriptions, qualifications, priorities. I found that when it comes to budget, it can either be on either end. It can be very expensive on the organization, or it can be readily not as expensive. It can be expensive if they do decide to invest in new clinical documentation, or it can also be a fairly nice budget when it just comes to re-educating the staff members on the importance, and basically having the risk management team go over the process. And the best way to find if there has been any changes is basically look at feedback, make the increase cybersecurity, try to incorporate interoperability between electronic health records, and making the goals more attainable. You would need full cooperation of your staff members, have them abide by the standards, creating long-term goals, making investments, and basically managing this process. And I talked about that really quickly about the risk factors, being that the budget, the duration, resources that can be used. Budget can be expensive, duration depending on what goal we use, resources, hospital funds, requirement, employees participation, positive impact, using safe internet connection, and applying interoperability, and basically using the electronic health record to communicate between two entities. And that's my references. Thank you.